Dear student, today I would like to tell you something relating to classification and assessment. And before we plunge into this particular topic, I would like to tell you the reason why people often refer to this particular topic or point. Because classification is absolutely essential, it is necessary to understand the problems. That is, it is based on classification is necessary in all branches of knowledge, and it is based on the assessment of what the client says and how he behaves. When you just say about assessment, it is the process of gathering information relating to his problem. The reason why we collect information is because we would like to help the client to cope up with the hard realities of life, and therefore assessment is very, very essential. And the reason why we take up classification, because we have to keep the individual under a particular category. So only when we have a standard measure, you can also call it by some other name, that is what you call a norm. So only when we have a norm, or only when we have a classification, we'll be able to understand where does the individual fall. And this is the point I just wanted to remind you. And we also take into account the events that people or client has experienced in their present and past future. And the classification of a person is what we call a diagnosis. And the diagnosis places a particular person or the client within an existing system or a group of disorder. Because we would like to help the client. Only when we know the kind of problem the client has, we will be able to do something fruitful so that he will be able to cope up with the hard realities of life. And this classification is a way of trying to understand and learn things from experience. So without a classification system, everything happens to be unique, and therefore we require classification, and based on which we just make the assessment. So far we have been talking about assessment and classification, and when we take up these two things, there are advantages and disadvantages. Supposing, we'll try to see something relating to this particular point. We come across a client who is having a peculiar problem. Let's say that the person is having severe problems like schizophrenic. Well, the person is one who comes from a particular family, particular society, and in case his problems are solved, well, he is going to join with the members of the family, with the members of the society. If this is the case, once the members of the family come to know that the person is having a peculiar problem, well, they give a particular brand name, that is mentally sick or mentally ill. If you come to know a person is not normal, if a person is having a little bit of problem or problems, how do you mingle with the particular client? So this is the problem. A label is given to that particular individual. So once a label is given to that individual, well, people normally, this is his company. That is quite natural. So even if the client is normal, after some time, just think about the status, mental status of the client, that is the amount of effort that we have put up. This is the problem. Labeling is a big problem. The second one is, once we classify the individual, once we come to know the individual is having this much of problem, well, these things, the problems relating to several other cases will help us in making some statistical process. Supposing the government seeks problems of individuals in a society, well, when we have the cases of this kind, we'll be able to give them. So they take some measures, or for that matter, they take preventive measures in order to reduce their problems. Like another point is, if the government comes to know, or the authorities come to know, or an organization comes to know that these are the problems that will be prevailing in the society, well, these people will take preventive measures before problem gets aggravated. And what happens, they take a lot of measures, like in some other problems like. So these are some problems that we have when we classify the individual in a particular category. What are the characteristics of a good clinical classification? And so far we have seen what is assessment, what is the classification, and we have also seen what are the advantages and disadvantages of a clinical classification. Now we'll try to see the characteristics. Now remember, a good clinical classification gives information relating to the causes or a cause of a particular condition. This is the first point. The second one is, when you have a classification or a standard norm based on which we just make the classification. If you have the kind of classification as standard one, well, that provides us a common language. This language will help people among clinicians to communicate each other. In case a clinician get a new client, so far the clinician has seen the kind of problem and he wanted to confirm what actually the client is having, what problem does the client have. So in case we have a common language, the clinician will be able to communicate with someone who is well versed in that particular field, so that he will identify where actually this individual falls. So this is the second point. And when we have a third point is, when we have a classification, we will be able to provide some meaningful information relating to the problem of the client, to the members of the family or those who are concerned with the client. Because members of the family, the people who are concerned with the client, are not aware of the causes behind. Once you control some of the factors that operate in an environment, once you manipulate some of the factors that operate in an environment, well, it is easy for people to maintain mental peace. And this is very, very important. And therefore, the classification will let people know, well, these are the factors that operate in an environment, because this one will people know, well, these are the factors, these are the conditions, these are the measures to be taken like. And therefore, classification is very essential. And it also provides, the next point is, classification will also provide the possible treatment. Unless we treat the individual, well, it is hardly possible to get him all right. In a way, we are helping the client to cope up with the hard realities of life. And therefore, we have to handle the individual as systematically as possible, and for which we require a systematic classification. And this classification will also suggest paths to take preventive measures. And as far as individuals' problems are concerned, it is always preferable to intervene as and when we come to know the person is going to get into problem. That is, the clinician is one who envisages, well, these are the problems that are going to happen, and therefore he takes a few preventive measures so that client will be rescued. Well, abnormal psychology of an individual, any individual for that matter, must be understood in terms of the context, that is, the factors that operate. So what factors do operate, or what factors are more responsible for a client's problem? So this is what I just mentioned some times ago. Once you control some of the factors that operate in an environment, well, it is possible for us to make some changes in the individual's behavior. And one of the factors is an individual's stressful events. That is, a loss of someone, death, that is what? Loss of job, calamities, natural calamities. These are some of the factors that will lead to individuals' stress. What is that called stress? Stress is a demand placed on an organism or an individual which demands cope up with the situation. Stress is a demand placed on an organism to cope and adjust. This is what stress is. What is that called adjustment? It is a process of establishing a satisfactory psychological relationship between the individual and the environment. Remember, the individual is not left alone. He is one of the members. He has to get along with the people around. In case there is an imbalance, it is not possible to lead our life in a peaceful manner. And therefore, we have to maintain as far as possible, we have to adjust in a smooth way like. And this is what adjustment. How do you just make adjustment? Well, there are two possible ways. Well, we try to change ourselves according to the needs of the environment. We have needs and so also the environment. We have to change our needs according to the needs of the environment. This is one of the ways. And what is the other way? Well, we try to change the needs of the environment according to our own needs. So both are possible. We can change our needs, no doubt. And there is a possibility that we change the needs of the environment. One is called, the first one, changing our needs according to the needs of the environment is called autoplastic, changing ourselves according to the needs of the environment. And the other one is called alloplastic, that is changing the needs of the environment according to our own needs. We cannot say this is preferable or this is preferable. Well, the person is one who understands the situation and accordingly either changes his needs or changing the needs of the environment. So this is what is the first point. The second point is person's vulnerability, that is low self-esteem. In case you have more power than the power that comes from the external environment, we will be able to resist whatever power comes from the environment. That doesn't affect our resistance. We will be able to withstand. We will be able to meet the demands that come from the environment. So this is the second point. And the third one is coping skills. The fourth one is intellectual abilities. If the person is intelligent, if the person is competent, if the person is productive, well, he will be able to envisage what things that come in future. Like accordingly, he prepare himself. Well, we say that he gets an alarm reaction from the environment. So these are the things that are going to happen. Accordingly, he prepare himself or herself. In case he finds that he doesn't have enough resources himself, well, he tries to mobilize his resources from the external environment, because we know pretty well that he gets social support from the environment, right? And this is how we meet the demands of the environment. What happens, how do we fix our goal? Knowing our competencies, do we fix the goal? Not at all. And in case you fix a goal within your limit, normally you don't get any problem. Even if you get a problem, you know how to employ some of the mechanisms that you have, so that you will be able to overcome some of the hurdles that you meet in your life. In case you fail in that endeavor, well, you will get more problem. So coping skills, the mechanism that we employ, and that too, we have to employ the right mechanism at the right time, so that we will be free from problems as far as possible. And the other one is resiliency, the ability to think clearly in spite of different circumstances. There are people who meet the characteristics of a good classification. Now let's pass on to the next one, that is multi-axial approach. And remember that we have been talking about classification, and this is one of the main classifications based on which we try to identify individuals. Now we'll say something relating to these approaches. There are various approaches available, and let's try to consider one of the approaches, that is called multi-axial approach. When you review history, you come across there are a lot of classification people could make, and the one that is being followed by almost all clinicians is the multi-axial approach. Today almost all practitioners use this classification system, and the first classification was presented long ago by the society called American Psychiatric Association, and a lot of problems was there, and they could review the previous classification. And recently, that is the year 1980, American Psychiatric Association published a classification called Diagnostic and Statistical Manual 3. And this classification has got some significance because the disorders were classified into 5 axes, axis 1 to axis 5, and individuals are classified in terms of the symptoms. And that was revised, that is in the year 1987. A revised system we got, and that is what we call Diagnostic and Statistical Manual revised, that is DSM-3 revised. And this has got, again the previous one, this has got some significance because like the previous one, this too has got 5 axes. In axis 1, most of the disorder except personality disorder and mental disorders, all the disorders except these 2 are presented in axis 1. And in axis 2, personality and mental retardation begin in early stages that are still persisting, and those problems are given in axis 2. And in axis 3, general medical conditions that seem relevant to a particular cause. And in axis 4, disorders like psychosocial and environmental problems are included. And in axis 5, and that is called axis 5 is global assessment functioning, otherwise GAF. That is, in global assessment of functioning, the individual's psychological and social problems are rating from 1 to 100. The clinician understands and analyzes individual's problem, and he places the client in some of the categories, like supposing the client is placed in the extreme, lower level. Well, he predicts that the client is able to cope up with the situation. And if the client is placed in the middle, well, we say that his problem, well, he has got some problem, but still he could get along, like. And if he's in the extreme case, clinician rates that it is 75, 80 or something like that. Well, we say that he is having acute problems. Now, these are about the classification. Now let's pass on to the next one, that is the interview process. Remember that a clinician is one who relies on various devices or various measures in order to understand the client's problem. What measures do we have? We have different techniques. We have different mechanisms through which we try to understand a client's problem. One of the measures is interview. And we also take into account various other measures like psychological tools and various other measures like. Let's consider only one, that is interview. What is that we call interview? Interview is a meaningful conversation between 2 or more individuals for a definite purpose. What is the purpose? The purpose is relating to the problem of the client. So remember that it is a meaningful conversation between 2 or more individuals for a definite purpose. And this interview can be classified into different categories based on function, role, and person. Let's talk about the interview process in terms of functions. That is, we say it is diagnostic interview, it is research interview, it is structured interview, unstructured interview. Well, it goes like this. We try to consider clinical interview because this is the one which is more related to our problem. Here the clinician takes, this can also be classified into 2, that is assessment interview and diagnostic interview. Remember that assessment interview always stands first because only when we assess, only when we just portray the individual's problem, well, we will be able to do something fruitful to the client. So assessment comes first always. And in this assessment process, and the one that comes next is the diagnostic interview. The let's say that the clinician takes up either structured interview or unstructured interview depending upon the decision of the clinician. Now let's say that during this process of interview, client exhibits verbal and non-verbal behavior. It is very, very important to understand. It is very, significant to note the non-verbal behavior of the client. During this process, we know why the clients seek help. Only when we conduct in the interview process, we will come to know the reason why client seeks help or the clients seek help. And what therapeutic measures do we take up in order to get some solution to the problem? Will help the client. And what are the contents of interview? The content includes, you should remember that initial interview is always unstructured. Clinician asks questions relating to the problem of the client. So before he starts this interview process, he prepares himself or herself. Well, these are the questions to be asked during this particular process. Well, he goes like this. And he is trying to help the client by eliciting information from the client. And it is not that easy to elicit information. Unless we establish rapport, it is hardly possible for a clinician to gather information from the client, to elicit information from the client. So what mechanism do we employ? What measures do we take up in order to elicit information? Well, we have to establish rapport with the client. A cordial, congenial, conducive atmosphere is to be created so as to elicit information from the client. And what questions the clinician asks? Well, these are some of the questions to be asked in this interview process. The first one is, who is the client? Well, in this particular part, we try to take into account the client's age, his personality, his attitude, his ethnic background, his family background, and what are all related to the client. As far as our knowledge is concerned, we have to gather all information relating to the client. Say we have to gather the client's biographical information. And the second one is, how does the client think? How does the client feel about life at the time? Well, here we try to understand the present status of the individual. What does he think about life? How does he look at the activities that go around? How does he develop kind of feeling towards the members of the family, towards the society, towards himself? How does the client feel about the life? How does he look at the various events that happen around him? And this is the point, second point. The third one is, what is the history of the problem and developmental background? And it is only the environment normally creates a lot of problem, because the person is with mostly and society also. So these factors that operate in the family and the environment create a lot of problems, and what makes him to develop, or what factors that were all responsible for the individual's problem, that must be understood. And the next point is, the fourth point is the present status of the client. What is the present status? How does he carry out his normal activities? How does he interact with others, or for that matter the environment? So this must be taken into consideration. And finally, the fifth point is how vulnerable, how resilient the client is. So these things, and apart from that, we have to take into account the kind of skills that he has learned in order to meet or in order to lead the life. And these are some of the questions to be included while conducting this interview process. And apart from this question, the clinician must also take into consideration the various aspects of behavior of the client. And there are clients who are shy, and it is very, as I told you sometimes ago, clients normally do not divulge certain information. They reserve something for themselves, and therefore problem remains a problem. And it is a task on the part of the clinician to understand, to portray the individual. So clinician must also take into account the factors like how does he behave during this interview process. Is he shy or very casual? And we have to look at the gestures the client makes. And there are people who avert their eyes during this process. Averting the eyes must also be taken into consideration. And there are people, who tap their feet. And this is very important thing. When you are in a state of tension, when something is not revealed, well, we just behave like this. And there are people who smile, and others who grimace, keeping their face in an ugly manner. Suppose you ask a question. The question is not that desirable or preferable. Well, I avert my face like. So these are some behavioral responses the client exhibits during this process of interview, and whatever the client makes must be recorded, must be taken into account. And let's try to see some of the factors that are involved in clinical judgment. What factors are involved in clinical judgment? And the clinician is one who is going through various problem-solving activities, and he takes a decision. So he has to understand the problem, analyzes the problem, then gets a solution to the client. And in a way, he is helping the client. And there is some disagreement in clinical judgment. That is what we call error. What kind of errors do we get in making clinical judgment? And we have identified a few errors. One of the problems, the first one is clinical factors. Now, the client is not constant, and he often changes himself. Supposing we say that one client is assessed by a clinician, that is, he is having alcoholic delirium. And after some times, let's say after 1 month or so, client is referred to some other clinician, and he again assesses the client's problem. Now, after a gap, another clinician comes to know that he doesn't have that particular problem. This is the disagreement that clinicians get because there is a time gap, and therefore the client changes. Client is changed, and the problems what he was having, is not persisting now, and therefore this is the problem that we get. The second one is method factor. That is the technique that we employ. Assessment technique is the same. One of the techniques that I follow, and you take up some other technique, well, then there is some errors that we get. And the third one is criteria factor. So different standards people try to follow. That is what we call norm. I try to follow one norm, and you try to follow some other norm while classifying the individual's disorder. So this is a problem that we get. And the last one is clinician factor. And the method that I employ differ the method that you take up. That assessment, the way we process the data, process the information, well, that differs. One. And my personality characteristics, something different from yours. Another one. The next one is the kind of training that I had is entirely different from yours, and therefore problem. And the theoretical orientation I just employ is entirely different from other clinicians employ, and therefore this is a problem. So these are some of the hurdles. These are some of the errors that we get during this process of interview. Now, how do you collect data? And after all, our prime task is, the main objective is to gather information. After all, this is what assessment talks about. Sometimes ago I just mentioned, it is a process of gathering information. What mechanism do you employ in order to gather information? Well, there are a lot of tools available. Do we rely on some of the tools available? in case we have a particular tool, well, we do not know whether the tool is reliable or valid. And what is that called reliability? It is the proportion of true variance, that is the consistency. And the other one is validity, is the degree to which a test measures what it is intended to measure. And this is what is. Now, while selecting a tool, you must know whether the tool is reliable and valid. Well, even if a tool is reliable and valid, well, we do not know the tool is applicable to our situation. And therefore, we have to go for revalidation procedures in order to confirm whether the tool is reliable or otherwise. One of the ways is this one. We have to rely on standardized psychological tools. And the other one is the one that we have talked about, that is what we call interview. The various other assessment, that is behavioral assessment. So these are, that is using psychological tests, using interview process, knowing this behavioral assessment, and these are some of the measures through which we try to gather information, we try to collect data. And now we'll try to see the role of interviewer. Now, he takes both assessment and therapeutic interview. Now, first one comes assessment interview, then comes therapeutic interview. While conducting this interview, well, there are a lot of factors again that influence the individual's data, that is the data that we obtain, that is age, gender, professional backgrounds, and various other information that influence this particular process. And so far we have talked about classification and assessment. Thank you.